The Canadian healthcare system is in crisis. But in this province, we've got a particularly made in Manitoba flavor. Hi, my name is Niall. So to understand why our healthcare system is in a state of crisis, we need to direct our attention to the provincial government. Back in 2017, the provincial government launched a multi-year project called Manitoba's Health System Transformation. If transformation means change, and change means cuts, and cuts means layoffs, and layoffs means staffing shortages, and staffing shortages means increased wait times, you get the idea. See, Manitoba's per capita spending on healthcare went from being one of the highest in the country to being one of the lowest. That's transformation. The transformation was sold to us as a necessary means to find efficiencies in the healthcare system and ultimately save taxpayers money. But what we found out is that efficiencies really meant cuts. So by the time COVID-19 hit, we were already 3 years into the government's austerity agenda. That meant the healthcare system had already lost capacity. And 4 years into COVID, the situation is so much worse. Healthcare workers were already being asked to do more with less back in 2017. But when COVID arrived, healthcare workers were suddenly hit with a monumental new challenge. This has created a vicious cycle in healthcare, where a shrinking workforce means that the workers who are left are forced to take on more hours and work more overtime, leading to burnout and sickness among staff. What would you do if your boss asked you to do your job without the tools you need to do it? You'd probably quit, right? And that's what healthcare workers are doing. They're quitting. But where are they going? Healthcare in all provinces is governed under the Canada Health Act. This is a piece of federal legislation that gives provinces and territories the money they need to provide healthcare services. But there are conditions attached, like providing free, quality healthcare to every person in Manitoba. It sounds pretty simple, right? That's because it should be simple. Manitobans deserve a healthcare system that's there for us when we need it. We simply can't allow the private sector to fill the gaps in the public system. By rejecting profit-driven healthcare, we keep healthcare services accessible and equitable for all of us. We have to demand good working conditions, competitive wages, and increased staffing so that the workers who left the public system will want to come back. Because clearly, austerity in healthcare fails us. It's time for some policy alternatives.